Well, good afternoon, everyone. Excited you're here. My name is Peter Denham, and today I'm going to be speaking on reform in American pharmaceuticals. There is a significant and real problem in our country today, and it's drugs. But not the kind that immediately comes to your mind. It's the kind that could save your life. It's a cold hard fact that nearly 60% of Americans use prescription drugs. That is nearly 3 in 5 adults in America. And the most staggering statistic of all is the reality that more and more Americans are becoming dependent upon these prescription drugs every day. Now, due to the increase of dependency upon these drugs, the market for prescription drugs has become a hot commodity for anyone who's looking to make a profit. And the reality is that's exactly what's taking place today. Drug companies and their CEOs are corruptly increasing the price of these drugs and raking in the benefit, leaving millions of Americans unable to receive the health care that they need. My desire is to see a country rise above the medical standards that are present within our society, receive better health care at a more affordable price, help people live healthier lives, and stop the corruption that exists in the prescription drug market. There's no doubting the fact that there is a monumentally big problem in our healthcare system today, and someone needs to do something about it. We need to stop corrupt drug companies and their CEOs from increasing the cost of prescription drugs above and beyond what normal people can pay. The prices are too high, and due to current policy, drug makers can charge whatever they want. We need to look to the global community around us and adopt similar systematic changes to our prescription drug policy here in America, reducing the cost of drugs by huge percentiles and providing appropriate health care for dependent Americans. Now, due to the policy within this prescription drug market, there is little to no regulation on drug companies and their CEOs. Now, this opens wide the door for corruption. The biggest issue with high prices in our drug market has a lot to do with the nature of drug companies and their CEOs. And it begins with no regulation in our market. You see, America stands as the only country that allows drug makers to set their own prices. Marcia Angel, in comment toward this, says that unlike every other advanced country, the United States permits companies to charge patients whatever they choose. Jay LaMattina from Forbes magazine continues commenting on this by stating that drug prices are not set by costs that are accrued in their discovery and development, but drug pricing is set by the value that the new drug brings to the healthcare system, value that is increasingly determined by payers such as insurance companies, governments, and even physicians. The problem is, our government is the only government to this day that doesn't negotiate or regulate prices. Marcia Angel continues by saying that the major companies are hardly strapped for money to cover their research and development. Now, when you look at their annual reports, it shows that they spend more money on marketing and administration than on their research and development. Pharmaceutical manufacturers are consistently among the most profitable of companies in our nation today. Now, the problem with corrupt business practices and increasingly high drug prices is that America faces an even bigger problem. Currently, the regulatory practices of the FDA encourage high prices from drug companies. Charles L. Hooper from the Library of Economics states that the main reasons for the high cost is the aforementioned high level of proof required by the Food and Drug Administration. Basically, the problem is that the FDA's process to approve prescription drugs is too slow. And what it results in is drug companies and their CEOs increasing the prices of these drugs exponentially. The FDA needs to change the way they regulate and test drugs. Too much time testing leads to increased prices. Now, not only does the US fail to regulate the market efficiently due to corrupt companies and an inefficient FDA, but it is one of the only countries that allows heavy direct-to-consumer ads on television. Jason Millman from the Washington Post wrote in an article that drug makers spent in 2014, get this, drug makers spent $4.5 billion in marketing. $4.5 billion in marketing. John Marshall from The Thrillist adds to this in an article stating that the United States is the only country besides New Zealand, that allows prescription drug companies to advertise on television. Now, the result of this overwhelming media-saturated exposure to drugs is a country full of misinformed drug consumers. Now, there was a statistic found online from prescriptiondrugspros-and-cons.org that states that 63% of physicians surveyed in April of 2013 believed that these advertisements on television misinformed patients. And 74% of physicians believe that these same advertisements overemphasize the benefit of the drugs, resulting in misinformed patients. C. Lee Ventola from the U.S. National Library of Medicine and the National Institutes of Health writes that the FDA's responsibility is to regulate the drugs on the market, but not only to do that, but to regulate how they are advertised as well. Now, recently, the problem is there's been a cut in funding to the FDA, and the result is a less strict regulation for direct-to-consumer ads. Now, due to the current climate of drug use in our country, we find ourselves at a crossroads. And Americans are paying the price, both physically and monetarily, to these corrupt companies and their CEOs, as well as an inefficient FDA. We must rise to the occasion to bring about change. Now, there have been many proposed solutions to this corrupted and inefficient drug market, but the best solution is a simple one. We must adopt pharmaceutical practices from our global community in order to create change. So in short, we need to globalize. America pays way too much for the drugs that we use in comparison to other countries. The solution is to go abroad to receive our prescription drugs. Now, in order to accomplish this and to avoid drugs that are dangerous for Americans, we must change the role of the FDA in regulating pharmaceuticals. David Broadwin from the U.S. News and World Report presents the idea that in order to make sure the drugs we receive from other countries are okay, we should create a small tax on imported drugs and support a squad of inspectors without burdening the general tax-paying public. Now, get this. The spread between the U.S. price of $750 per pill compared to Brazil's 2 cents per that exact same pill would cover a lot of inspection in America if we need it and still result in a much cheaper pill. And here's the thing, a cheaper pill results in more lives being saved. Globalizing our trade for pharmaceuticals will reduce costs much more efficiently than our current FDA scope, but it will only make a small dent in the problem unless we change the way that information is spread to the masses. There's no doubting that there is a correlation between the amount of advertising on TV here in America for prescription drugs and our overall poor health as a nation. Dr. Mercola, from his website, relays that there's no doubt that the United States has been manipulated into becoming a polypharmacy nation. The word polypharmacy simply means many drugs, and it refers to instances where an individual is taking too many drugs, either because more drugs are prescribed than are clinically indicated, or when the sheer number of pills simply becomes a burden for the patient. The key word to understand from this quote is manipulated. As a country, we have become manipulated by consumer advertising on television into believing that we need pharmaceuticals, when in a lot of instances, we don't need these drugs. It's possible to create change, and currently our country desperately needs it. If we are able to adopt regulatory practices from our global community, the results will prove monumentally beneficial in the long run for Americans. The drug prices will decrease, and that will allow people who desperately need healthcare to receive it. And it will end this corrupt money-making game from drug companies and their CEOs. not only will that occur, but America will become a much healthier nation overall. No longer will we be misinformed about prescription drugs on television. People will be informed in a much safer environment about their treatment options in the safety of their doctor's office, which is the way that it's meant to be. However, if we are unable to bring reform in our country, we can only expect things to get worse. Drug prices will continue to increase as time goes on because, honestly, the current market provides that. It's a money-making game. That means that the rich will continue to get rich. And America will continue to be known as one of the poorest health countries in the world. We have some of the most poor health outcomes. People will continue to be misinformed by advertising on TV and become swayed by half-truths and propaganda, leaving more and more people at the mercy of drugs that they may not even need, resulting in deteriorated health and poor lifestyles. Change is desperately needed today. Our country is plagued with an issue that must be solved. The U.S. pharmaceutical market is run rampant with corruption, and Americans are paying the price. We must do our part as informed U.S. citizens to pay attention to ways we can bring about change. And maybe you're here today and you take prescription drugs. My encouragement to you would be to seek out as much unbiased information as you possibly can from your physician about what that prescription drug is even doing to you. Because we live in a country, we live in a nation where there's a lot of biased opinion and advertising on television that is corrupt. My desire is to see a country rise above the medical standards that are present within our society, receive better health care at a more affordable price, help people live healthier lives, and stop the corruption that exists within the prescription drug market. Thank you guys for listening.